What is a fever for my child in Fahrenheit and Celsius? Imagine your child playing happily one moment and then feeling warm to the touch the next. That warmth might be a sign of a fever, which is a common response when the body fights off an infection. But what exactly counts as a fever? The answer depends on how you measure your child's temperature and their age. For infants and young children, the most accurate way to check is usually by a rectal thermometer, which is inserted gently into the child's bottom. When the temperature reaches or exceeds 100.4 degrees Fahrenheit or 38 degrees Celsius, it is considered a fever. This method gives the most reliable reading for babies and toddlers. If your child is older and can cooperate, you might use an oral thermometer by placing it under their tongue. For older children, a temperature of 100 degrees Fahrenheit or 37.8 degrees Celsius or higher usually indicates a fever. Keep in mind that oral readings tend to be about 1 degree lower than rectal readings. Another common method is measuring under the arm, called the axillary method. A temperature of 99 degrees Fahrenheit or 37.2 degrees Celsius or higher can suggest a fever, but this method is less precise. It often reads about 1 degree lower than rectal or ear measurements. It's important to remember that normal body temperature can vary slightly throughout the day. Typically, a child's normal temperature ranges from about 97.5 degrees Fahrenheit or 36.4 degrees Celsius in the early morning to 99.5 degrees Fahrenheit or 37.5 degrees Celsius in the late afternoon or evening. For infants under 3 months, any fever should be taken seriously, and you should contact a healthcare professional right away. Even a slight increase in temperature can sometimes be a sign of a serious infection in very young babies. Fever itself is not harmful and is actually part of the body's natural defense system. It helps the immune system fight off germs. The key is to monitor your child's behavior and other symptoms, like fussiness, difficulty breathing, or lethargy, alongside their temperature. In summary, a fever in your child is generally a temperature at or above 100.4 degrees Fahrenheit or 38 degrees Celsius when measured rectally or by ear, or 100 degrees Fahrenheit or 37.8 degrees Celsius when taken orally. Always consider the child's overall condition and seek medical advice if you're worried or if the fever lasts more than a day or two. Remember, each child is different, and a healthcare professional can provide the best guidance tailored to your child's needs.